Hi everyone, Dr. Hall. I'm going to do the posterior or deep surface of the anterior abdominal wall. Okay, so I know that's kind of a mouthful. So just imagine we are inside the abdominal cavity right now. So anterior is here, posterior is this way. We are deep within the body cavity. So my external oblique is here, then my internal oblique, and then my transversus abdominis with, of course, its horizontal fiber direction. And in the midline, I can see my rectus abdominis muscle. And on the deep surface of my rectus abdominis muscle, I have the superior epigastric artery and veins and the inferior epigastric artery and veins. The tendinous intersections would also be present here. Unfortunately, I only put them on the anterior surface. And we have our linea alba and the umbilicus. So I kind of cheated a little bit when we did the anterior surface, and I pretended that the parietal peritoneum was entirely smooth. Turns out it's not. It has some really interesting folds in it that make for some important structures. So we're going to do kind of a deeper dive and take a look at that. So again, here is my transversus abdominis. So the next layer moving deeper, of course, would be the transversalis fascia. And then on top of that, we would have the extraperitoneal fat or fascia. So that brings us now, finally, to doing the parietal peritoneum in a bit more detail. So the parietal peritoneum is this membrane, of course, that covers the inside of the abdominal wall, but there are some really interesting features. First is that we have a remnant of a fetal structure, the umbilical vein. So this was the vein that was bringing oxygenated blood from the placenta back to the fetus. So I've shown it in blue, but it really should kind of be red because it's carrying oxygenated blood. But so that remnant of the umbilical vein bringing blood to the fetus, right? And of course it's coming through the umbilicus here, is in a fold of peritoneum like this. Oof, stay there. Okay, and this fold travels up to the liver, which is on the right side of the abdomen. And since we're deep in the abdomen, we're looking from the posterior towards the anterior. This is the right side now. And so you have this free edge of this fold where you find the remnant of the vein, and that is called the round ligament of the liver. And then you have this like sail, this almost like triangular like sail here, and that is called the falciform ligament of the liver. So traveling up to the liver. All right. The other folds we have are all inferior to the umbilicus. So these are also structures that are going in and out through the umbilicus in fetal life. Let's see if I can get things to stick a little bit better. In the midline, we have the uracus. Now the uracus is a connection between the umbilicus and the bladder, and it has to do with how we form embryologically. Then on each side, we have a remnant of an umbilical artery. Kind of looks like a peace sign almost, like that. Each of these three structures is in a fold of the peritoneum. Let's see if I can make that happen. So a little fold here around the remnant of the umbilical artery, little fold here around the remnant of the uracus, and a little fold here around the remnant of this other umbilical artery. So these have specific names. So again, this is the round ligament of the liver, and then the falciform ligament is that broad swath of peritoneum that is folded together. And then we have these three down here. The two on the sides are the medial umbilical folds with the remnants of the umbilical arteries. And then in the middle, we have the median umbilical fold with the remnant of the uracus. So we have three folds inferiorly, the two medial ones and the one median, medial ones with the umbilical artery remnant, median with the uracus remnant, and then traveling superiorly from the umbilicus, we have the remnant of the umbilical vein which is now called the round ligament of the liver, just that free edge, whereas the whole broad fold is called the falciform ligament. And that's it.